This was a very interesting case of infantile spasm that we had. This was a 3-month-old baby girl with uneventful birth, developing well, and who was apparently normal until the age of 2 months when she developed a URTI infection. Following this, she was noticed to have these episodes of jerky movements, and following which she gradually regressed in terms of her milestones.
So my presentation started slow regression as a red flag. And this case in the presentation was prepared under the supervision of my mentor, Dr. Samir and Muntasir, whom I'm very thankful for. So let's talk about the history of presentation. So this was a 5-year and an 11-month-old boy who was previously healthy, typically developing. The parents brought him to the clinic with the following complaint, that 6 months prior to that clinic visit, he started to develop the following symptoms that they've noticed. He started to have frequent falls and started to become more tremulous. He is avoiding playing with other kids.
If the patient has arterial blood gas or blood sugar measurement, and do you have any peripheral blood smear comment about the patient in the QA box?
Yeah. So when the patient presented to the emergency, we had done the capillary blood gas, which had shown that there was elevated lactate, which was around 2.6, as I mentioned earlier.
Thank you very much. So for case 1, the biotin thiamine responsive basal ganglia disease, I wondered whether, I think you mentioned in the quantitative amino acids, you had no abnormalities. If there's elevated lactate, there's oftentimes some elevation in alanine, which is shuttles between lactate and alanine, as well as leucine and isoleucine. But again, I think it depends on when the samples are taken. If it's
for his first night out, binge drinking, drank vodka, started to vomiting. His parents thought he had a hangover. He ended up having brain swelling and he coned and he died. We did his testing. He was the one who was in PICU for 14 hours and no one appreciated the gas when they should have thought this patient was going to be acidotic. It was alkalotic. And when the metabolic team saw we got the ammonia done, it was over 2,000, but it was too late to save him. And that's just reinforcing how important it is throughout your careers to really take action on that kind of gas.
No, just again, thanking all the participants. This was very comprehensive. This was great. I felt, it would be nice to have even more time, but, I think this was a great review. So thank you all, and thanks to all of the audience. And we will be seeing you next month in our new FLICNA podcast.